Hello, my name is Kylie, and today we'll be interviewing for the A2 Still PA program. I'm going to ask a couple questions first, and then you'll have time for questions at the end. First, tell me a little bit about yourself.
Hi, my name is Nicole Easy. I was born and raised in Chandler, Arizona. I've lived in Arizona all of my life. For my undergrad, I went to the U of A where I studied physiology and biochemistry. I had multiple leadership roles on campus. I was a preceptor for physio, and I also was on the board of a Women in Medicine and Science club where we did a lot of community outreach and initiatives to help our community. And that's a little bit about me.
Okay. Why do you want to go to medicine? Specifically, why do you want to be a PA or not a doctor or NP?
I want to go into medicine because I love helping people, for one. I really love the PA profession because it's collaborative. I've always been a collaborative person, and I like that as a PA, I work on a multidisciplinary team and I can reach out to my colleagues if I need assistance in a patient's case. I also like with the PA profession that I don't have to necessarily choose one specialty and work in that specialty for the rest of my life. I've always been interested in different specialties, so I think that that's another good aspect of the PA profession. I think the NP and MD route is also beneficial, and we definitely need them as well. But I've never really been interested in pursuing those routes. And another thing that I like about the PA profession is that it's definitely very competitive getting into PA school. But I feel like once you're in PA school, your classmates are very helpful and it's more collaborative versus in medical school where you're essentially competing to match into a specialty. So I think that's
Mhm.
also a great aspect of the PA route.
Yeah. If you couldn't go to PA school, what would you do?
If I couldn't go into PA school, I would definitely still want to do something healthcare related. I wouldn't necessarily choose a different profession per se, but I would do some type of community outreach or volunteer in a clinic. I'm also a very creative person, so I think that I would find a creative outlet that I'm interested in, such as like interior design or fashion. I think that's something that I would be interested in.
Where do you see yourself in 5 to 10 years as a PA?
In 5 to 10 years as a PA, I see myself working in primary care or internal medicine. I definitely, um, working in primary care is what has motivated me for becoming a provider, because I've seen firsthand how the lack of access to healthcare really affects my community, especially with my dad growing up. He never really saw healthcare providers. He only would go to the emergency room when he needed healthcare. So I think that's something I definitely want to address. And I feel like um, going into the PA profession, I am helping address this issue. In my personal life, I see myself married with kids and just happy and traveling and doing the things that I like to do.
Tell me about a healthcare experience and how it has prepared you for PA school.
I definitely think my clinical, like I think the clinical specialties I worked in has definitely prepared me for PA school. Fresh out of college, I started by working at a dialysis clinic, and it was definitely a learning gap. I accessed fistulas and grafts, and I learned how to basically I learned how to access fistulas and grafts, which is a definitely a, a it's definitely something that I'm grateful for experiencing because now I have very good venipuncture skills, and so I think that's definitely prepared me for PA school. I also think working in the urgent care has prepared me for PA school because I worked at an urgent care that was in a more rural area in Chandler. And so we were exposed to a lot of different populations. A lot of the patients were on Axis, which is something I have never seen before. So I think that's definitely
Yeah.
prepared me for PA school. And I think now working in a surgery center, scrubbing in surgery, just learning all the instruments and working with anesthesiologists and surgeons, I think has definitely prepared me for PA school. Um, I think it's a valuable experience that I've had thus far, and I know that I'll definitely see all these things that I've learned again in didactic and in clinical year. So I think just exposing myself early on to them has definitely prepared me.
Can you describe a situation where you had to handle a difficult patient or family member? How did you manage it?
Yes, a time that I had to handle a difficult patient. Um, there was a patient that came in with her boyfriend, and when I was going through the questionnaire, the boyfriend was talking over her and answering all of the questions, and I couldn't necessarily talk to the patient. And so the first thing I did was I tried to have the boyfriend leave so that I can talk to the patient in private. And the boyfriend was actually very combative and he didn't want to leave. He said that he would only leave if his girlfriend was leaving as well. And that's what ended up happening. They both left the urgent care. And in that situation, I feel like it's definitely important to respect patient autonomy. And I did all the necessary steps that I could. I talked to the doctor about it, and we called um, the services that we needed to report this. And essentially, that's all we could do in that situation. I think it's important to recognize that some things might be out of your control as a provider, but the first thing that we need to do is respect patient autonomy and their rights.
How do you handle stress or pressure, especially in a clinical setting?
I think the first thing that I like to do in stressful situations is just remove myself from the situation. I think, for example, if I feel like I'm going to cry in front of a patient, I would excuse myself and then go into the break room or the bathroom or wherever that may be and then feel my emotions. I think it's definitely important to validate your emotions. I think it's healthy for humans. We all experience different emotions. So I think the first thing is feeling your emotions and then reframing your mindset and trying to understand the emotions that you're feeling and just having a way to bring yourself back to reality is important. I think what helps me is breathing techniques and just thinking of the positives in the situation, I think helps handle stressful situations.
Yeah. What is the most challenging class you've taken and how did you overcome that challenge?
The most challenging class that I've taken was definitely organic chemistry. The first time I took organic chemistry, I received a C. And that grade was definitely deserved because I did not reach out for help. I didn't really do anything that would set me up for success. And so the second time around, I did a lot of practice questions because for organic chemistry, you definitely need to practice. Um, I also went to office hours and collaborated with my classmates a lot more than I did the first time around. And I think that this definitely helped improve my grade. The second time around, I received an A. And I think that just shows that sometimes you have to take a step back and look at what you can do to help set yourself up to be in a better situation. And I think that will definitely translate to being a healthcare provider.
Yeah. Describe a situation in which you had to demonstrate empathy.
I think a situation where I had to demonstrate empathy would be, for example, I had a patient that I needed to get their labs, and the patient was scared of needles. And so I just talked to them in a calming tone and just explained the process to them and let them know that I'm going to need 5 tubes from them. If they stay still, I will barely have to insert this needle into them. And I think just letting them know what we're doing as we're doing it helps calm their nerves. And I think that was very empathetic of me to do.
Um, what do you think is the most important quality for a PA to have?
I think the most important quality for a PA to have is cultural competency. And I think this is important because as providers, we see a variety of patient populations. And at the end of the day, we all have our biases. So I think that it's important to separate that, especially in healthcare. We want to treat everybody the same, and we need to understand that there's different cultures, and try to understand how we can help them and tailor our treatment and just tailor our treatment to their culture and try to understand them. I think that's important.
What do you do in your spare time to relax or manage stress?
In my spare times, I'm creative, so I like to cook. I'm also really into skincare and makeup and fashion. Um, I like traveling with my friends, and I'm a Disney adult, as some may say, so I like to go to Disneyland quite frequently. And I think those are some things that I like to do in my spare time.
Yeah. What questions do you have for me?
What does a typical day in the life of an AT Still student look like?
Yeah. So it depends on what year of the program the student is in. If they are in the classroom phase, Monday through Friday, they'll probably be there 8 a.m. to 5 p.m. Obviously with breaks, but just learning inside the classroom alongside your classmates. We give multiple opportunities to do stuff outside the classroom as well. But, and then depending on the clinical year, we'll place you in clinical rotations, where you get to be in the field and work with different providers. So it honestly just depends on what part of the program you're in. But yeah,
Great. Thank you so much.
thanks. Good job.